This is one case. We are all well trained and well schooled in what to do.
And do it they did, swamping test sites across Melbourne.
I came quite early in the morning and I still have to wait.
Just thought, I'd come and get tested sort of thing, so the right thing to do.
I've just got to stop everything and do this.
More than 500 Oz Open players and staff are also awaiting test results. The new case, a quarantine worker at one of their hotels.
We've been advised very low probability that any of them would test positive.
The infected worker's 2 family members have tested negative. Authorities now worried about possible transmission at more than a dozen sites. Potentially more worrying, though, is exactly how he got the virus in the first place.
We have reviewed literally days' worth of CCTV footage, and it's fair to say that this person has been a model employee. We can find no problem, no breach of protocol. This model of hotel quarantine, every other state and territory has agreed to copy this model. It is best practice.
But increasingly contagious strains of the virus are pushing that model to its limits.
One of the things we can't rule out is that there's aerosol transmission, so airborne transmission of this.
On a COVID ward in the hospital, there's a regulation that says the best airflow change is about 12 complete fresh air changes every hour in a hotel. It's nothing like that. It can be as low as 4 to 6 airflow changes.
Airborne transmission might also be responsible for the virus spreading between a quarantined family and another returned traveller announced yesterday.
The viral load in the room of the family of 5 was so high that just even opening the door to pick up your food has seen the virus get into the corridor.
No doubt this will be a feature of the report that I'll give to National Cabinet tomorrow.
Also up for discussion at National Cabinet, going regional. Queensland pushing to move quarantine to federally run specialised facilities like the Northern Territory's Howard Springs, which hasn't had a single leak.
In a purpose-built facility, people could open their windows, open their doors, go for a walk. All the things would reduce opportunistic airborne spread.
So with these outbreaks becoming more widespread, how do we ensure our best practice hotel quarantine system stays on top of the virus?
Well, epidemiologist Professor Tony Blakely is right on top of this issue and he joins us now. Tony, how worried should we be about this Victorian case?
Yeah, OK, how they got it is one issue and whether they've transmitted to the community is another. So there's a lot of contact tracing going on out in the community at the moment. We hope we get lucky like in Greater Brisbane and in north of the North Island of New Zealand where somebody going out with a transmissible variant didn't spread it. As far as back in the hotel, though, we don't really know how this person got it. The last case that we know about in that hotel was the 22nd of January. They might have caught it from that person, but that's a long incubation period. Or there's silent transmission happening in the hotel, or he even picked it up out in the community and just happened to be picked up because he's a hotel worker. Those things will be revealed as we get genomic testing and more results from contact tracing. But this is a bit of a mystery.
Do you think that it might be time to acknowledge that ventilation in hotel quarantine is a bit of a problem?
Well, it's over time to acknowledge it. So best practice here is Howard Springs, all those places where you've got in a rural area, you've got lots of space between the areas, you've got natural airflow because this thing doesn't transmit too much when there's natural airflow. If we can build more Howard Springs type facilities, we'll send more people there, but I doubt we'll get to the point where we can't also be using hotel CBD. So we still need to think about all the things we can do in hotel CBD to improve the quality of that. And that includes looking at the ventilation systems, minimising people crossing paths. One example is if you had a fire exit at one end and another end of a corridor in a hotel, then open them both and get that airflow coming through to try and clear the place out. We need to learn as much as we can and go for total quality improvement here.
Wouldn't it just be easier, though, to expand regional quarantine much more significantly and use that?
I would, if I could wave a magic wand, that's what I would do. It's interesting to think whose responsibility this is. There is a federal constitutional responsibility for quarantine, as I understand, but I don't see a lot of action from Canberra to try and institute rural-based and proper textbook quarantine as we knew before COVID. Queensland is talking about opening up mining camps, but the more discussion we can get like this and try and get some of these facilities open, the better, because we've got at least 6 months, maybe 12 months of needing this type of quarantine facility. So as much as we can, yes, let's go regional and rural with this.
Tony, just very quickly, face shields for hotel quarantine workers have been suggested to prevent something called eyeball transmission. Is that a thing now?
It's always been a thing, so it can come in here through your eyes and through your mouth and through your nose. Now, the mask is the most important part, but when you see people in full PPE kit, they're wearing glasses, goggles or a face shield. So when people are delivering food and healthcare items to people in the rooms, they're wearing that full PPE kit. With the security guards sitting outside the door, well, ideally we get them off the corridor so that we just use CCTV, but if they're sitting there, they should be wearing a mask and maybe some goggles as well.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.